Hello, Dr. Zane here. I wanted to review for you the MedPsych behavior diagnostic tool that you see before you. You might want to get your own copy so you could take notes on it, but we'll go through there. I'm sure most of it will make sense to you. Again, it's another an indirect assessment method. It particularly applies to this week where we're talking about medical and physical assessment of the gathering of that sort of information that could help us uh, determine the function of a particular problem behavior, helping us figure out whether it's medically elicited or evoked, or if it's more or operant in nature. But anyway, we have here, let's see, description of the individual, the rationale, which in this form means defining the target problem behaviors, um, and they're asking for some other information, the use of emergency restraints and so forth. The psychiatric diagnoses, you will get these from a psychiatric evaluation or a psychological evaluation. Axes are the different sorts of diagnoses, the primary, secondary, so forth. And then question 4 is an interesting one. Often psychiatric diagnoses are accompanied with certain behavioral patterns or what do we call those? Phenotypes, behavioral phenotypes, and you might want to know what those are there. Some information in number 5 about past evaluations. Number 6 is about the medications, of course. And then we get into questions about services that the person is receiving, physical illnesses. Note question 9, real interesting. If medical problems exist, does that influence the frequency of challenging behaviors? Allergic reactions. Question 11 gets at pain and discomfort. And then if no, we ask, does the individual engage in behaviors which would suggest that the individual is in pain or discomfort? And then we get questions that I think you've seen on other indirect assessment devices: sleep cycle, diets, hours of sleep, food allergies, types of foods they eat. Now on the next page, just again some questions. Many of these we've covered before, all trying to tease out environmental or physical influences that could account for the behavior. So medication changes that could have spiked a behavior, changes in the environment, daily routine, changes in transportation. That's an interesting one. I don't think we've seen that one before. Does the behavior occur in a crowded or noisy room? That was on the functional assessment interview. So you get the point here. Question 17 is a new one, interestingly. Just a lot of another category of information that we might be able to use to tease out the particular function. Okay. So I hope this one is helpful. I think you should fill this out. It'll be part of your indirect assessment information. A lot of the questions may not apply, but I'm sure some of the questions you can answer as it relates to your particular target student, okay? So hope it makes sense. Drop some questions in the form if you have any questions or comments about it, okay? Thank you.